Welcome back to Plastic Surgery T&A. That's Talking Advice. I'm your host, Dr. Earl Stephenson Jr., and it is another Saturday. Hope you are happy, healthy, and well wherever you are in the world. And I want to take a few minutes today to talk about asset protection. And I don't mean ass, but I mean really asset protection. A lot of clients come to me, they trust me, they know that I built systems to protect them. But here's something that I don't think a lot of clients know. You can cover to a certain degree your cosmetic surgery, protecting it from complications or protecting you from getting stuck with the bill after a complication. You want to know about this? I think you should take a minute, stop, listen to what I'm going to say. I think it could save you in the long run. So stay tuned. A little business first. As always, I thank everybody who's joined me over the last year plus on this podcast. Your help, your viewership has really helped my channel get at least on the algorithm so it can show up in feeds. So, what I ask you to do is to continue to tune in, and we're grateful, but really to share our platform. So share this platform so that others can benefit as well. If you are new here, welcome. Please do me a favor, press that subscribe button and hit the bell icon so that you'll know when new uh, episodes air. So on that note, business is taken care of. Let me tell you a little bit of a story. There was a 52-year-old woman who was seen by me. We decided to do multiple procedures. Multiple procedures can lead, in my opinion, to potential complications. Now, complications can happen even with single procedures, but the longer that a client may be on anesthetic, there's potentially and anecdotally or intuitively there may be a slight uptick in complications, and complications are a part of surgery. The majority of time clients come in, that we discuss a procedure, we go through the risk and complications thoroughly. The clients understand that. The clients have the procedure, they recover, and they're on their way without really any hiccups. Occasionally, despite my best effort, despite any board certified plastic surgeon's best efforts, complications occur. So the first step is to really discuss these with your client. That happens in my practice a couple of times, minimally two. First, at your first visit with the consultation with me. That's why one of the reasons we take our time during our consultations, we're not rushed. It's a consultation at least minimally of an hour. So we go through the risk and complications for said procedures that the client desires. If the client decides to work with me and then move forward, and we're at the point of our preoperative examination or appointment, that's usually an appointment that occurs probably about a week at the very latest to 2 weeks prior to the procedure, where we rehash everything to make sure that everybody's on the same page, all our I's are dotted, T's are crossed. And at that time, not only do we go through the procedure, we sign the appropriate paperwork, we do our appropriate lab work, we do our physical exam, but we spend time again really discussing the risks and complications. So, with this particular client, we decided to do multiple procedures: breast, tummy, butt. Procedure was long, took more than 7 hours. Procedure went well. Patient stayed overnight, which is another fail safe I think I place for patients to make sure that they're well monitored. Patient went home the next day and was doing well. We called her that afternoon. She was doing well. Lo and behold, the second day after surgery, I get a call from an outlying hospital saying that this patient's in the hospital. They have low blood pressure and they need care. So the patient was then transferred to a hospital close to me so that I could care for the patient. I'm gonna stop here, and this is another key point that I want to really take time with for just a second. I'm a board certified plastic surgeon, as you hear me say all the time. I have privileges to perform aesthetic procedures in an outpatient freestanding surgery center. So I can do a tummy tuck, I can do breast augmentation, I can do liposuction, you name it, at those facilities. But I also can perform those procedures at my local hospital. And I have privileges to care for patients at my local hospital. I can place them in the hospital or admit them to the hospital. I can provide non surgical care. And in this case, this patient needed what we call technically fluid resuscitation. In large procedures like that, fluid shifts, and you have loss of blood. The blood is replaced in surgery with fluid, sometimes, but rarely, if ever, blood. A lot of times, some of my colleagues are using cell saver where they actually lose the blood, but it's captured, it's recycled, clean, processed, whatever you want to say, and then reintroduced to the patient while they're in surgery. That's another good, effective safety measure. But nonetheless, we replaced it with typical IV fluids per my anesthesiologist. We monitor her heart, monitor her kidneys, so on and so forth. But these little fluid shifts, and I won't say little, these fluid shifts occur even 1 to 2 to 3 days after, where the body is recognizing, hey, we've lost we're down a quart or three. We need to gather some fluid from some stores that we have. We need to encourage our person to drink and try to balance things. But sometimes, despite all of those best efforts, it comes up a little short. And so, when you're a little low, your body can respond in a couple of ways. It can respond by you having not the quite as clear, not the quite the clarity that you need to have. So you're a little foggy from a physical exam point standpoint. You may have a really rapid pulse or heartbeat. You may stand up and feel woozy and want to feel like you want to pass out. So those are some of the signs that you can have when you're a little short or a little low in the tank. This patient was low in the tank, so her blood pressure was pretty low. We like to keep our blood pressures as a standard and a generality, with the top number at least being over 90. And the pulse rate at least 100, low below 100, if that is the patient's baseline. Typical everyday pulse rate, they usually run below 100. Those are real generalities. Sometimes people chronically or routinely run pulses over 100. Now, if you work those people up and send them to their cardiologist or so on and so forth, then this is not a problem. And that's just where they live. If somebody's pulse rate is typically 115 and you perform surgery on them and now their pulse rate is 137, then that might be a problem. But typically, most people may run below 100. So we want to make sure that our blood pressure is above 90, the top number. We want to make sure our pulse rate or heart rate is less than 100. But in this case, hers was not, which meant she needed not only fluid, which she's already gotten, she needed blood. So we gave her a blood transfusion. We care for her in the hospital. We monitored all the things, got her tanked up much better. I say that to say all this. Again, despite our best efforts, things happen. What if this patient didn't have one, medical insurance, or two, we didn't build in my practice, again, another failsafe of providing clients with coverage for situations such as this. This is cosmetic surgery insurance. And we work with a particular company called CosmetAssure. So, what is CosmetAssure? As I pull that up, CosmetAssure, as you can see here, is provided to all of my patients registered under CosmetAssure for one or more of the covered procedures. And we'll talk about the covered procedures here. It covers complications up to 45 days after surgery. It's really, really a very comforting thing to have. If you have medical insurance, there's no guarantee that the medical insurance you carry, the Cigna, the Blue Cross, the Anthem, the what have you, United Healthcare will cover this. So this insurance, which is very affordable. For example, for a covered body procedure, it'll cost $230. For a breast procedure, it may cost $150. That's it. And it will cover you for complications. So, what are the covered complications? Let's take a look at that. So, you guys can all read, but I'll highlight a couple of them. Excuse me. Abdominoplasty or tummy tuck, common procedure. Breast augmentation, very common procedure. Let's look at something else. Facelift, very common procedure. Rhinoplasty or nose job. And you can see there's the list is quite extensive. So again, these are common procedures and these are covered procedures when you are signed up with CosmetAssure through your board certified plastic surgeon's office. So, what are the covered complications? Again, we don't expect to have complications. They're really low, but they can occur. Surgery is a practice and it is not perfect. So, what are the covered complications? So, covered complications are broken down according to CosmetAssure into basically heart related, surgery related, and anesthesia related. So, anesthesia related can be really severe low blood pressure or severe high blood pressure within about 3 hours after the procedure. Surgery related can be bleeding, which is hemorrhage, or infection, or hematoma, which is a collection of blood underneath the operated area. And I have a couple of examples of that. So let's remove that for just a second and show you that. Here's a patient with a facelift, not my patient, but a patient who's had a facelift and has a collection of old non-active blood that looks like kind of jelly underneath her skin. Makes her look horrible, probably makes her feel terrible. It's pressure, it's painful, and it needs to be treated. And some people are, well, this might be swelling, it just needs to go away. Old blood or a hematoma underneath something like an operative area like a facelift or a tummy tuck or around a breast implant is a great setup. And I don't mean that in a really positive way. It's a great setup for infection. Bacteria love to munch on old blood. So we got to take care of this. So that's an example of a hematoma. For heart related or cardiopulmonary related complications, it could be low oxygen. It could be a blood clot to your lungs. It could be, for heaven's sakes, a heart attack or a abnormal heartbeat. So these things are covered, and it's covered for a nominal cost. So how do you get this? How do you as the client get this? Well, unfortunately, you can't go and get this on your own. You can't go to a broker, you can't go to a marketplace and get this. So you may really fancy a plastic surgeon. He or she may not participate with CosmetAssure. And if they don't, you can't, as an individual, go out and get it. So as one of maybe your criteria for choosing your plastic surgeon, maybe that they should have some type of plan to help you cover complications. There still may be some out of pocket costs to you, but this certainly can cut those down dramatically. And if you have the good fortune of having, you know, medical insurance, typical, usual medical insurance, there's no guarantee that they'll cover any of this at all. So you need, as part of your process of kind of picking your plastic surgeon, look for your plastic surgeon to have or offer CosmetAssure. You can't get this yourself. So, really, really important. to help you to lessen the stress of this whole journey. Because despite the joys of it at the end, it is a stressful journey. You're taking off time, you're changing your schedule, your family's dynamics will be off a little bit, you're paying money or you're investing in yourself. You're going to have surgery, which is anxiety provoking for anyone, because from your end you don't do surgery, so you don't know. This is not a routine day for you. For on our end, this is what we do every day. So for you to kind of minimize your anxiety, at least if something doesn't quite go as expected, you've got a little bit of a security blanket with CosmetAssure. So it is our policy and procedure as a quality control to offer that. So I challenge you, no matter where you are, if you're in New Mexico, you find a great plastic surgeon in Albuquerque or Las Cruces, and they don't carry CosmetAssure, you might think really hard and try to see if they would even consider covering you, and signing up for the program. As a plastic surgeon, we can't pick and choose. Either you're in or you're out as far as cosmetic sure. And for my practice, it's a no-brainer. We just gonna be in. We want to make sure that everybody's protected, make sure their assets are protected, meaning their ass is protected. So we want to make sure that you have the safest journey possible. So your plastic surgeon can't pick and choose. You may ask them, they just can't say, well, we'll do it for you and not do it for someone else. So they really have to be committed to this. If you're still fancy them and they don't want to participate or don't participate, then my pearl of wisdom to you would be then to be proactive. Call your insurance company. Talk to whomever you need to talk to, document these, get emails and say, hey, I'm going to have a cosmetic procedure that I'm paying out of pocket for. I'm not looking for insurance coverage for the procedure. But if there is a complication, I need a blood transfusion. I have to stay in the hospital because I'm dehydrated. Would you cover that first and foremost? Is that covered? And if it's covered, to what extent is it covered? Is it after I pay and meet my deductible, and then I have to chip in 30, the insurance company chips in 70%? You got to work those numbers. So that's what I would do. But probably the easier thing to do is not get your medical insurance involved in all. Find a great plastic surgeon that offers CosmetAssure. So CosmetAssure is, and I may be wrong about this, so don't beat me up, but I think they really only work with board certified plastic surgeons. I'm almost certain about that. So first, look for this symbol, certified by the American Board of Plastic Surgery, and then just look for CosmetAssure. It's typically on our plastic surgeons' websites. Sometimes it's not. Just ask when you are either making your consultation or you're in the consultation. Hey, do you offer surgery insurance? It's a simple question. And then make your decisions accordingly. So just wanted to take a little time. This is perfect. It took me about 20 minutes or so. Take this back down. I want to really bring you helpful information. I just don't want to ramble for 45 minutes, 50 minutes, and not really say anything and you lose interest. So, the point of the day is make sure when you choose your plastic surgeon that they offer cosmetic surgery insurance. And usually, CosmetAssure is going to be the player in the market. They're the longest standing, biggest insurer. So, and they work closely with the American Board of Plastic Surgery, the American Society of Plastic Surgeons, and of course, obviously, with board certified plastic surgeons. On that note, ladies and gentlemen, we're done. It's a quick episode. These episodes will be quicker, sharper, more pointed, and really, I hope, more helpful. If this has been something that you have really liked, you're interested in the procedure, you want to work with me, I'm going to give you the song and dance as I do every time, because I feel that I can be helpful to a lot of people. And if you're in Atlanta, hey, look me up. It's really straightforward. Even if you're not in Atlanta, we offer consultations that are virtual. So first thing to do is you can call the office at 770-466-4700 always, and set up your appointment for your consultation, either in person or virtually. The consultation fee, regardless, is $225. Again, it's a minimal 1 hour. A lot of our consultations go longer than that because we want to make sure that our clients are well informed. They're armed with information when they walk away from our consultation. And it doesn't mean that, we don't get upset if you don't want to work with us. You want to work with someone else, or you don't want to do it at all. My goal is to craft a plan for you and give you information so that you are armed and make great decisions. Again, whether it's to work with me, and that's what we hope, work with somebody else, or decide, hey, this is not for me. So, easiest thing to do is call the number 770-466-4700. We love to work with you. On that note, thank you for watching another episode of Plastic Surgery T&A. That's Talking Advice every Saturday here on YouTube. Until next Saturday, I wish you peace wherever you are in the world. See you next time.